Good morning, and welcome to your weekly cup of Joe. My name is Joe King. I'm the owner of Physical Therapy Advantage in North Aurora. Coming to you today with trying to answer a question. Get this question quite often is, what's the best position to sleep in if I have back pain? And that's a really, really tough question because everybody's back pain is a little bit different, and there's lots of different causes and pathologies to back pain. But in general, typically, if you have back pain, low back pain, we're going to say, is that sleeping in the fetal position is the best position. So lying on your side. And doing so, you want to make sure that you're lying on your side. You want to make sure your head's in good position. All right. You want to make sure your head's in a good neutral position. You don't want it cranked up, and you don't want your head tilting too far down, that sort of thing. The other part of it is maybe you need to support your arms a little better so you're not curled up in a fetal position too much. You want to be on the side like a fetal position, but maybe I'm laying on my left side here and I got my pillow and I'm good head position, but I have a pillow underneath my armpit here on my right side, so it's kind of blocking my right arm. So I'm not laying in a deep, hard fetal position and curled up too much in a ball. For sure, you want to make sure you're putting a pillow between your legs and knees. So it can go from your ankle all the way up to your knees to help keep that hip rotation, pelvic rotation, and low back torsion, keep it a lot more in a good neutral position. So those are extremely beneficial. People ask, can I sleep on my stomach? Some people don't like sleeping on their stomach, and I'm one of them. I'm not a stomach sleeper by any means. Typically, if you're sleeping on your stomach, if this is your low back right here, and then you'll typically sag and you're going to arch, and that strains and compresses that low back. But there are a lot of people that like to sleep on their stomach, and that's okay if it feels comfortable to you and it doesn't aggravate your symptoms. Most of the times that people, if they're sleeping on their stomach, they're kind of shifted to one side, left or right. If they're shifted to the right, their left hip and leg are kind of up, and so their hip is kind of flexed and the knee is kind of bent, so they're kind of a little bit to the side, and helps turn them and rotate them. That helps turn their head to that left side as well, because you can't sleep with your head straight down, so you have to be able to have your head turned one way or the other way. And you're going to figure out, and that's developed way when you were in utero before you were born, which way, if I sleep on my stomach, which way do I like to have my head turned if I'm sleeping on my stomach? And that's okay. You probably just don't want to be there all night long. You'll have to change positions, and changing positions frequently throughout the night is definitely okay. And, a lot of times if you're having good sleep at night, you don't know what the heck you're doing at night. You don't know what kind of positions you're flipping and flopping. And next thing you know, how did I get in this position? Sometimes it makes you feel not so good because you got in a position you're not used to and it really, really hurts. Or sometimes it feels fine and you're okay. One of the best things you can do with sleep and stuff like that is do an assessment of your bed. How old is your bed? If it's old and worn down and broken down and too soft and not supportive, it's probably not doing you any good. So you may want to get a new bed. And I can't tell you what kind of bed or anything like that to get. You have to go try them for yourself. It's great that they have at least 30 to 60 to 90-day trial periods. I say use them and definitely test them out as long as you possibly can, from a sleep number bed to a Tempur-Pedic bed to a hybrid bed to other types of foam beds, or just a regular coil mattress. So you want it fairly firm, a good firm support. It doesn't have to be hard as a rock, but a good firm support. But you can have a little bit of cushion up on top, whether it be some foam or hybrid foam or some sort of pillow top that's not going to just go flat and or create divots and stuff like that. But you can definitely have some cushion on top of that foam because you got the good support underneath. You have to try to see what works best for you. Hope this answers your questions. I know sometimes it's a little bit more of a vague answer, but hope it gives you some good ideas. If you have any questions about this or low back pain in general, or other sleeping positions and low back pain or anything else, please don't hesitate to give us a call at 630-892-8003. That's 630-892-8003. And we look forward to talking to you next week for your weekly cup of Joe. Bye.